Point of order before I put the question.
To correct my right honourable friend, but she did refer to my old constituency as Cirencester and Tewkesbury. Of course, it is now the Cotswolds.
Wonderful. There we are. Two corrections there. I will now put the question. The question is, as on the order papers, may I please say aye? For the contrary, no. I think the ayes have it. The ayes have it. Thank you very much. We now come to the debate on guaranteeing the right to maintain contact in care settings. And I call Dan Carden to move.
Thank you, Mr. Deputy Speaker. I beg to move that this House has considered the matter of guaranteeing the right to contact in care settings. After much delay due to circumstances outside of our hands, I'm grateful that we now have the opportunity in this chamber to debate this incredibly important issue. Can I start by thanking the Backbench Business Committee for its efforts in finding us time to speak in the chamber about this today. And I also want to extend my gratitude to the Honourable Member for Chatham and Aylesford and the Honourable Member for St Albans and the Honourable Member for Dyford Merredon for their steadfast and resolute support and advocacy on this matter throughout. People across the United Kingdom are still having to face their time in hospitals, in care homes and other care settings completely alone and detached from the people that they hold dearest. They are some of the most vulnerable and frail people in our society. Some of them will be nearing the end of their lives. The devastating impact of this isolation and of denying contact with loved ones affects those in receipt of care and also their loved ones. It is difficult to imagine, unless you have personal experience, the anguish, the pain and distress of not knowing when you will next see your loved one, your husband or your wife, your mother or your father, and repeatedly asking yourself, are they okay? Are they comfortable? Do they even know that I care? That same anguish and pain is experienced by the individual receiving care, not understanding why family or loved ones are not able to visit. Shirley from my constituency said, "My father forgot I was his daughter during the period I was unable to visit. When I was finally able to visit, my dad was unrecognisable. It broke my heart. He has never recovered." The support of partners, the care that they give, the care given by parents, by children, this isn't an optional extra. Contact with loved ones is absolutely vital to dignified care. This point was also made by the 363 members of the public who in the last few days alone provided written evidence for this debate, and I want to thank them for their brave contributions and the Chamber engagement team for collecting them. I know that throughout today's debate we'll hear further personal experiences from across the Chamber, but I hope the House won't mind if I take a moment to talk about my own family's experience last year. My mother and brother have contributed a few words to this, and I'm grateful to have the opportunity in the Chamber to express them. Because my father, Mike, died last year. He was diagnosed with lung cancer in February and died in December. Like many people undergoing cancer treatment, one evening he suddenly became unresponsive and we had to rush him to A&E. At the hospital, it was confirmed that he had sepsis and he was therefore isolated in a side room on the A&E ward, which was overrun with patients on beds and trolleys in the corridor. My dad was in an A&E side room for 3 days, during which time he didn't receive any hot food, He wasn't showered or washed, nor assisted in changing his clothes, and he was unable to get help to go to the toilet. Instead, he was given cardboard containers which were often left full on his bed table for days, despite regular requests for them to be taken away and replaced. And throughout this time, he had no means of contacting us because there was no phone signal where he was, and he couldn't access the Wi-Fi despite repeated attempts. There were other occasions. Once he had to be moved to a ward when he was left with his emergency buzzer out of his reach, and one time when he couldn't breathe and began to panic, he phoned my mum, who was unable to get through to the ward by phone and therefore rushed to the hospital. He told us after these experiences that he had felt so lonely and neglected and unable to alert anyone to his basic needs. And my dad was a man who never liked to make a fuss. The hospital policy at the time was that visitors were only allowed for patients who were in end-of-life care. The NHS website defines this as follows. End-of-life care is support for people who are in the last months or years of their life. End-of-life care should help you to live as well as possible until you die, and to die with dignity. The people providing your care should ask you about your wishes and preferences and take these into account as they work with you to plan your care. They should also support your family, carers, and other people who are important to you. However, at the time, the hospital defined end-of-life care differently and restricted visiting rights to those patients who were actively dying. In other words, that they were displaying the physical symptoms of dying. My mum said, this meant that instead of being able to focus on caring and supporting my husband through his final weeks, we had to battle with the hospital to see him. The trauma of my husband's death, and in particular the neglect he experienced in his final weeks of life, remain with me. It is almost exactly 1 year since Mike was admitted to hospital, where he spent the last month of his life, and I am still overwhelmed each time I attempt to talk about what he went through. I want to also turn to the words of one dementia sufferer who said, I'd forget that I had an allergy, but my daughter was there to correct me. If alone, I would simply have said I didn't have an allergy, and that could be so dangerous. The lack of input from family and friends, the people who know people best, leads to much worse outcomes for those receiving care. In March of this year, we invited affected constituents to an event where they could share their experiences with parliamentarians on the estate. The testimonies we heard were harrowing, and the collective trauma was palpable. To give just one of the contributions from that day, sitting with my mother's body was the longest time I had been allowed to spend with her since she had entered the care home 16 months before. The powerful event that day left members of this place that were there united in the view that a legal right was needed to secure the right of care users to nominate an individual to provide support or care in all circumstances. Many of us at the event were disappointed by the response of the government and the Minister for Care. Since then, 60 members sent a letter to the Secretary of State for Health and Social Care, at that point the member for Bromsgrove, pushing for codification, a legal right to be put in law. We were again left disheartened by the response from the Minister. While we were told that the government was committed to ensuring care home residents have access to the support and companionship that loved ones bring, there was no answer to our request for a meeting or consideration of our proposals. Understandably, campaign groups felt ignored once more, and I hope the Minister today will not leave those affected feeling the same way. This problem is not exclusive to the coronavirus pandemic. there are still rigid restrictions on visiting as well as shocking instances of denying contact. Another of my constituents reported, "My family and I have never been allowed into the care home that he now resides in. Restrictions have caused unnecessary stress and anxiety to my family and I." I will give way.
I wonder would you agree with me that now is exactly the time that we should be considering this, because as we go into the winter, the option of imposing restrictions is going to become an option that many care settings are considering, and I think that guidance alone has proven insufficient, and this is amongst the lessons that we should have learnt over the last 2 years, and now the government should be acting.
Yeah.
I'm grateful to my honourable friend for that intervention. The government has previously pointed to guidance as being the defence against bad practice, and I think we have enough evidence to see that that simply isn't good enough. Indeed, while there are some excellent examples of good practice across the sector, there exists significant levels of uncertainty and variability throughout the system that seriously undermine the rights of individuals. The guidance leads to a postcode lottery as separate settings interpret guidance differently. This difference of response is compounded by the response of the CQC, an organisation that I know many have had difficult and negative interactions with. The government encourages those affected to report care providers who do not meet this guidance to the CQC, but by then it may be too late. This poor response is not because the CQC ignores complainants, although there was evidence of this as well, but they simply do not have the proper powers or data to support people to have visitors who have their access rights compromised. In the CQC's own words, we do not have the power to require care homes to report live data on levels of visiting. Neither do we have the power to take action against those care homes that are not reporting changes to their visiting status to us. The CQC, which regulates all health and care services in England, bases its enforcement action on the capacity tracker. However, providers are not obligated to use this tool. They're merely encouraged. And this has led to very little, if any, clarity on the true extent of the problem. By comparison, in Scotland, the National Care Service Bill places a duty on ministers to require providers to comply with any direction made regarding visiting. So can I ask the Minister, what assessment has the Department made of this legislation, and would they be minded to introduce similar provision in England? The evidence suggests that the only way to guarantee contact in care settings is a legal right to an essential care supporter. An essential care supporter would be able to visit or accompany a person in any health and care setting to help communicate their wishes and needs and to ensure they receive the correct care. If the government is serious about their support for these calls, if they're serious about acting in the interests of families and loved ones, if they're serious about balancing clinical restrictions with the impact of those restrictions on residents' health and human rights, then I would ask the Minister to immediately consider how to put this into law. I can't think of any other issue that commands such unanimous cross-party support. Indeed, as the Right Honourable Member for Leeds Central, who I know supports these calls wholeheartedly, said at our meeting in Parliament, how can anyone be opposed to this? There are also 35 organisations in the area, in this area, who support these calls, including Mind, MenCap, Disability Rights UK and Dementia UK. The new Secretary of State for Health has previously signalled his support for this right. We are ready and willing to work with the government to make this legal right a reality as swiftly as possible. The Joint Committee for Human Rights has also been unequivocal in their call for legislation in this area. In their report from July of this year, Protecting Human Rights in Care Settings, they stated that the government must introduce legislation to secure to care users the right of one or more individuals to visit and provide support or care in all circumstances, subject to the same infection prevention and control rules of other staff. We have not yet had a response from the government to this report, so may I ask the Government Minister to take this up. We have opportunities in the draft Mental Health Reform Bill and the Bill of Rights to codify this right. The government could also introduce secondary legislation, which I know campaigners are in favour of. So will the Minister meet with me and others and the affected families as soon as possible to discuss making this right as strong and effective as possible? The government has previously said that legislative options are under active consideration. So please can the government give much more specific detail of what this actually means. And I want to finish by paying tribute to the tireless campaigning of organisations in this area, particularly the Rights for Residents campaign group, the Relatives and Residents Association and John's campaign. The work of Jenny Morrison, Diane Mayhew, Helen Wildbohr, Julia Jones, Nikki Gerard and Kate Meacock has been absolutely inspirational. They are all in the public gallery today watching this debate, and their dedication to this campaign has been phenomenal, and I pay tribute to them. In the face of immense loss and personal grief, they have shown incredible selflessness and service to guarantee that no other family member will have to endure the pain of being denied contact again. Families do not deserve any further delay. They have suffered enough. We must learn from this trauma and bring in legislation. I hope that when the Minister rises to give the government's response, she will agree and set out the steps that we can now take to get this right. Thank you, Mr. Deputy Speaker.
Thank you, and deepest condolences on your loss as well, Dan. The question is us on the order paper, co-sponsor Tracey Crouch.
Thank you, Mr. Deputy Speaker. And ordinarily, when we stand up in the chamber, we say it's a pleasure to follow an honourable friend. And I have to say, given his speech, his very powerful speech, may I just say it's an absolute privilege, and I feel very humbled to be following him in this debate, which I was very proud to be a co-sponsor of. And of course I echo his words, thanking people who have engaged and taken time to give us their testimony during this debate, especially the groups that he referenced and the people that he referenced, plus of course all those that have sent briefings for this debate. Mr. Deputy Speaker, in 2015 my father had a stroke which left him physically and neurologically impaired, requiring him to spend the rest of his days in residential nursing care. My sister and I visited him on a regular basis, observing his decline from manly patriarch to someone with childlike vulnerabilities in just over the course of a year. Now, I won't romanticise the relationship I had with my father, which had been fractured since teenage years, but I can honestly say that those months of us visiting him in care were the closest we had felt to him in years. And it is true to say that during COVID, I often remarked that I was glad that he had died long before the pandemic, because while no one wants to see their parent or loved one lying on a bed, a thin, pallid skeleton, saying their final goodbyes, blessings, or apologies, hours before their death, nor should they be denied that right too. Tragically, during the pandemic, and in some cases still today, many of my constituents and others around the country were denied visiting rights, whether that be to care, celebrate, or sadly say goodbye. Now, I think we should just pause for a moment to cast our minds back to the start of the pandemic in early 2020. It was ripping around communities, transport systems, offices, retail places, and of course health and social care spaces. It was killing people in large numbers, especially the most vulnerable in society. People were frightened and our understanding of the virus limited. We went into lockdown and isolated our loved ones because we thought it was the kindest and safest thing to do. And we all understood why. I look back through my casework files in preparation for this debate, and I found hardly any complaints about limited access to relatives in the first lockdown, because in a Blighty-esque spirit we got on with it and found alternative ways to communicate with those we couldn't ordinarily see. Many of us here stamped our feet about care workers not getting enough PPE and rightly included them in our doorstep clapping, because they were heroically looking after their residents when family and friends couldn't visit anymore. And we understood that fear, that if one resident caught the virus, it could be devastating for the entire setting and the duty of care that they held. But then lockdown ended, the summer arrived, the virus declined, our understanding of the virus improved, and our hopes of going back to see residents in health and social care settings were raised. Yet looking at my casework, this is where the problems began, and unfortunately still continue. Now, I should stress that I am in no way criticising any individual care home manager or any staff for the examples I'm about to cite. My criticism is squarely with the department, whose guidance published for managers to interpret themselves was wishy-washy at best, and why I now firmly believe that while you can still respect the individual business that a care home is, a right of access should be enshrined in law to give both the manager, the resident and the relative clarity when it comes to visiting. In November 2020, I was contacted by Francesca, whose nan was admitted to a care home following a short stay at a local hospital. Francesca's family were not able to visit, despite being told she was dying and that they would potentially be allowed only a 1-hour goodbye. Not only was this hugely distressing for Francesca and her family, but also for her grandmother, who was coming to the end of her life without her loved ones around her. The guidance was often cited, but the lack of clarity within it left care settings making decisions that were understandably in its interest, but not of that of the resident or the family. In this case, and after my intervention, visits were allowed to Francesca's nan and goodbyes said, but the uncertainty and distress caused could have perhaps been averted with a simple right of access that was clear in its intention. Likewise for Mura, whose mother was in a specialist nursing home. It houses some very vulnerable and elderly people, and everyone, including Mura, understands the need for caution. When the virus surged in December 2020, care settings like the one Mura's mother was in effectively went back into lockdown, where named visitors were allowed if they underwent testing, a process no relative has ever complained about. However, because the guidance enabled homes to design and implement their own COVID outbreak procedures, many were able to prevent access even to the defined essential caregiver, denying the love and support from loved ones during another period of isolation. Now, one really important aspect that was reiterated when I sat with colleagues listening to powerful and, as the Honourable Gentleman said, harrowing testimony from campaigners on access and support rights, many of whom are in the gallery today, was this is not just about older people in care homes or those at the end of life. We heard from Wendy Mitchell, who, if you follow her joyous Twitter feed, you will know is living well with dementia. She highlighted her experiences of going to appointments alone during the pandemic. I do not need to explain in detail the utter idiocy of allowing those with dementia to attend a healthcare setting where discussions about condition, medication and so on are discussed. In the past, in the 1970s, it would have formed in the head of a scriptwriter some sort of sketch show, except it's serious and potentially extremely dangerous. We also know that youngsters fared particularly badly from the pandemic, and those within care settings were affected quite acutely. And I was reading back through my correspondence relating to a young man called Thomas, who has learning disabilities and is in a residential care home. He had a birthday coming up, but the care home were denying his parents the ability to take him home to celebrate, despite the fact that they themselves were, wonderfully I hasten to add, taking Thomas out for community visits. My own correspondence to the care home explains perfectly well what the problem was, and it read, I've managed to speak to colleagues in both the health department and the education department about Thomas's particular set of circumstances, and both encouraged me to look at the ethical framework that care settings are required to operate under. I was also reminded that those with learning disabilities such as Thomas are not considered clinically vulnerable and therefore do not require shielding in the same way others with significant health conditions are. I know that government guidance in residential settings has not exactly been perfect, and the care home managers and teams are doing their absolute best to navigate their way through, doing what they think is best for both the client and their staff. However, there is a difference between the home Thomas is in and that of an older, much more vulnerable person, and therefore flexibility is perfectly possible. It is with that in mind, and with the guidance for the whole nation being slowly eased to allow greater human interaction, alongside an appeal to your sense of compassion given Thomas's mother's deteriorating health condition, that I write to urge you to reconsider your decision to not allow Thomas to visit his family home tomorrow for his birthday. There are no rules that stop you from doing this, and I know the family will be forever grateful. Now, I'm pleased to say that the home did allow Thomas to go home for his birthday, but the fact that he was allowed to go home for his birthday, but the fact that Thomas's case alluded to 2 different departments and unclear guidance was the core cause of great anxiousness. When in September of 2020 a similar case arrived from Dawn about her son with complex medical needs living in 24-hour nursing care, she rightly noted the impact the first lockdown had had on her son. She wanted me to write to the then minister, who I'm pleased to say is back at the dispatch box today, to make it clear that a family member could be recognised as an essential part of care home staff and allowed to come as much as any other member of staff. She felt homes like the one her son was in were never mentioned because people automatically thought of care homes in respect of our elderly population. I think Dawn's message, and that of many others, was that we heard, but its application still today remains sketchy. A lesson to members: make sure you take with you the last page of your speech from the printer. After rereading these cases and listening back in March to the testimony of others who had suffered from being unable to visit loved ones, it is in my view a no-brainer to have an absolute position on this matter. The guidance was not clear enough and caused distress to residents and relatives as a consequence. Now, I know the Minister will cite CQC guidance, but it's not strong enough, hence why so many now feel it needs to be enshrined in some form or another. The Minister will note that there is cross-party support for this matter. We could do this quickly and we could do it in time for the winter. So please, I hope that she will consider these pleas seriously. By doing so, it protects the care home managers, as well as giving the residents the right to have their loved one with them, providing support and care as necessary. We can learn a lot from the pandemic, and I'm sure we will. One of those lessons must be about the devastating impact on physical and mental health of isolation on those in social care settings. And I repeat, Mr. Deputy Speaker, concluding my remarks, I repeat my point drawing on my experience with my own father 6 years after his death. No one wants to see their loved one vulnerable, incapable of basic functions, or in their final hours. But nor should anyone be denied that important time with them either. Sadly, many were, and some still are. So it is with that in mind that I urge the Minister to think carefully about her response this afternoon, but ultimately bring forward legislation as soon as possible.
You're the co-sponsor, Daisy Cooper.
Thank you, Mr Deputy Speaker. I'd like to extend my sincere thanks to the Honourable Member for Liverpool Walton for leading this important debate, and to the Honourable Member for Chatham and Aylesford for co-sponsoring the application. I'd like to pay tribute to both members for sharing their own experiences and that of their constituents in such an incredibly powerful way. I'm also incredibly grateful to the Relatives and Residents Association, the Rights for Residents Group and John's campaign. Their endless determination to highlight this glaring gap in the law to protect some of our most vulnerable at their most vulnerable has been critical in securing this important debate. I have to say that unlike the two honourable members who have spoken already, and many from the campaign group, some of whom are here today, I have not been personally impacted by this matter, but many of my constituents have. And there have been too many examples of families being separated from their loved ones, as I say, often when they were at their most vulnerable. Each and every story has been absolutely heartbreaking, and I would like to share just two of them today. The first is that of Steph. Almost 2 years ago, in November 2020, during a debate in Westminster Hall secured by the Honourable Member for Beaconsfield, I was able to tell colleagues about my constituent Steph from St Albans. Steph's mum had dementia and had been living in a care home since December 2018 after it had become impossible for Steph's dad and sister to look after her at home. Steph's mum was visited every single day either by Steph's dad or one of her 4 siblings, until the pandemic hit in early 2020. Before then, they were able to lovingly hold her hand, comb her hair, remember stories together, and reminisce about the past. But this wasn't just visiting. Steph and her family were providing essential care. Contact and reassurance from loved ones is so incredibly important to all of us, but it's especially critical for people with dementia. Family members know their loved ones best. They can identify the very subtle changes in their physical and mental health far more quickly. Often residents feel far more comfortable opening up and sharing their concerns with close family, much more comfortable than they might do with a care worker. And that's even more true when they don't always understand what's happening to them, as well as you or I might. But suddenly Steph and her family were separated from their mum. And for more than a year, contact was limited. Initially, it was limited to phone calls or sometimes video calls, and in the latter half of the year, this was relaxed a little, but only then they were still only allowed to visit outdoors under a garden building. Unsurprisingly, like so many others in this awful situation, Steph's mum simply just couldn't understand what was happening. When being presented with an iPad for video calling, she thought she was watching a television programme. Yeah. She simply couldn't understand that she could interact with it, and she found the ordeal incredibly confusing. Fences, window visits, plastic screens as barriers, none of these worked for people who were living with dementia either. They became incredibly frustrated because they just couldn't hear what was being said. Sometimes they just simply couldn't recognise their loved ones at all at such a distance. Others just simply couldn't comprehend what was going on. Some felt like they'd been put in prison. In early spring 2021, Steph's mum's condition deteriorated. She was moved to a hospice where family members could finally spend time with her and be close to her, comfort and care for her. And sadly, she passed away in April last year. After such a long time of being physically separated from her mum, Steph says that she was, in a sense, almost lucky that in a different setting, she and her family could actually spend time close to their beloved mum at the end of her life. But too many others have been denied those precious final moments together. I'd also like to talk about Lynn, because we know that these restrictions haven't just been limited to care homes. Dementia patients and the vulnerable were prevented from seeing their children, spouses and carers in other health settings too. Now, Lynn is a constituent and a friend, and she discovered this whole experience at Christmas time last year. Lynn's husband, Andy, also has dementia. Until December 2021, Lynn had been looking after Andy at home with the help of regular professional carers. In a devastating blow on Christmas Day, Andy's condition suddenly deteriorated. He had to be admitted to our local A&E department and was transferred to an acute admissions ward whilst a bed in a suitable ward could be found. While other wards were now accepting visitors, because this was supposed to be a temporary unit, Lynn couldn't see Andy at all. The rules were the rules, and there were no exceptions for those, like Andy, who needed familiar reassurance and help to communicate their needs. As it turned out, because of a lack of suitable beds, Andy spent almost 2 weeks in this area. And it wasn't until Lynn contacted me, and I intervened by contacting the hospital management, that she was allowed access to her husband, Andy. Now, we all know that the NHS was and continues to be under considerable pressure, but a lack of suitable one-to-one care with somebody who Andy trusted had devastating effects. Lynn was utterly distraught by his very dramatic and sudden weight loss in the days that she was separated from him. And eventually, after further direct contact from my office, the ward sister finally agreed that Andy's professional carers could also visit. We all know that dementia is sadly a progressive condition, but neither Lynn nor I were in any doubt that the pace of his deterioration in those days over Christmas last year was hastened by the lack of contact with those that he loved and trusted. He had been denied access to his essential caregivers. Now Andy is in a care home, and when I spoke to Lynn last night, she simply said this: "It's so important that people in care homes have access to their loved ones. Andy isn't ready to be stuck there until he dies. without love and physical contact. The humanity needs to come back into care. Now, Mr Deputy Speaker, we have come a long way since last Christmas and even longer since the beginning of the pandemic. But as winter approaches, the NHS and care settings are once again expected to struggle with a surge in COVID cases, and it is not inconceivable that what happened to Lynn and Andy could happen again, to them and to many others. We now understand much more about effective infection control with COVID. We regrettably now also understand from very harsh lived experience the impact of separating those with dementia from their loved ones and essential carers. Guidance exists so that safe visiting can be facilitated by care home operators, but as we've already heard, the overwhelming response from relatives across the country shows that this just isn't being implemented in a consistent or fair way. As it stands, care homes are continuing to apply rules that are far in excess of the measures recommended by the Department for Health and Social Care guidance. Reportedly, more than 10% of care homes didn't permit any visitors at all during COVID outbreaks between April and September this year. 20% of care homes confined residents to their rooms for up to 28 days during an outbreak, and almost half of homes reportedly have some form of visiting restrictions in place, even when there may be no outbreak at all. Now, about the CQC. As it stands, there is absolutely nothing relatives feel empowered to be able to do about these wildly varying rules put in place by the homes they have entrusted their loved ones to. In advance of this debate, the Care Quality Commission got in touch with members of this House to set out what they think they can do about this scandal. Now, the CQC agrees that it is absolutely vital that people are able to spend time with the people they love. They tell us that where they become aware of guidance, that they will take action. But, and this is the critical point, Mr Deputy Speaker, the CQC do not have the powers to require care homes to report to them any visiting restrictions that the homes put in place. Now, I am very grateful to the Chamber Engagement Team for conducting research in advance of the debate today. As honourable members have said before, 363 people just in the last few days have responded to that survey. And that survey shows that more than 70% of relatives who had concerns about their loved ones had concerns about their loved ones in care homes had not contacted the CQC to make a report. Now, those who did contact the CQC reported mixed success. Some told us that things did improve, but the vast majority say that there was either no improvement or that the CQC wasn't interested or simply didn't respond. And this is the crux of it. One person who responded to that survey, a woman called Joanne, says, "Because I spoke to the CQC, we were threatened with eviction from the home." And this is what so many of my constituents tell me. They fear making a report to the CQC because there are no legal protections for visiting their family members. They are terrified of being labelled as a troublemaker, or from being stopped from visiting their loved ones altogether, or from their loved ones being evicted. There is a huge power imbalance which cannot be right. Members of this House met with the relatives campaign groups in Parliament in March of this year, as other members highlighted earlier. We heard the heartbreaking testimony from families and service users about the effect that these restrictions had had. Every single person agreed that the guidance simply wasn't working. Everybody agreed that enough was enough. And everybody agreed that we needed protections in law. Everyone, Mr Deputy Speaker, except the Minister at the time, who had unfortunately not been able to make it until the very end of the session with a pre-prepared speech, and who hadn't heard the powerful and harrowing testimonies of those people who attended, many of whom are in the public gallery here today. But the Minister is here to hear some of these powerful testimonies now. And I hope that she will conclude, like we have, that the evidence is overwhelming. We absolutely must put an end to this scandal. We have to be able to say, never again. As other members have said, there is cross-party support for this. We will work with the government to put this into law. Surely the time has come to create a new legal right to maintain contact. Thank you.
So you can see we've got 4 backbenchers wishing to contribute. We have 3 front bench contributions and Mr Carden at the end. So please, can I just ask people to look at the length of their contributions, as we will be going to the wind-ups just after past. Esther McVeigh.
Thank you, Mr Deputy Speaker. I want to thank the member for Liverpool Walton and congratulate him for bringing this debate here today, and also the member for Chatham and Aylesford for co-sponsoring this, because this debate has been deeply distressing listening to the stories that have been told here. Human beings have rights. They have the right to education, the right to healthcare, the right to body autonomy, the right to equality, and the right to a private family life free from government interference, to be able to spend time with their loved ones. And it is a sad fact that all of those rights that I've just listened came under attack during COVID lockdown. But we've moved on from lockdown and COVID restrictions have ended. So it is deeply harrowing to discover that for some that is not the case. Stories we've heard today, stories from my constituents, and also it was highlighted in the weekend in the Sunday Times. And I am horrified that 7 months after the removal of official restrictions, care home residents are still being denied visits from their families and friends. It needs to be mentioned too that some care homes are open and allowing visits, but others are not, and continue to stop family members seeing one another, which is simply inhumane. Beyond cruel, isolation and loss of social contact has a devastating impact on physical and psychological health. Without the support of family and friends, health outcomes are poorer as residents lose hope, sometimes even losing the will to live, often refusing treatment. And for residents with dementia, it is especially devastating as they don't understand why their relatives haven't been to see them. Many also have serious sensory impairments, and for them, physical touch and communication with family members might be all that they have left. And I'm more concerned that this situation is concealing neglect and abuse. As co-chair of the All-Party Parliamentary Group for Pandemic Response and Recovery, I've heard from campaigners back in April and more recently who warned of widespread and shocking safeguard issues involving medication, hydration, hygiene and the lack of basic care. Families must be allowed full access to support, protect and advocate for their loved ones when they need it most. What can be done to end this unnecessary suffering once and for all? It is now beyond urgent that care homes, local authorities, UKHSA and the Care Quality Commission stop blaming each other for these appalling failures of policy and take action. Rather than requiring new legislation, we need to uphold existing laws. Article 8 of the Human Rights and the Mental Capacity Act, and should have protected against this situation ever arising. Instead, this legislation is being willfully misinterpreted as an excuse to keep people isolated in care homes, and sometimes they feel as if they're prisoners. So I call upon the Minister to get tough on any care homes that block residents from seeing visitors. There should be severe consequences for those who continue to blight the lives of those in care, and they should face some kind of fines or legal action. We are failing vulnerable members of our society, and it is simply cannot be allowed to continue. We must end all unlawful visiting restrictions and stop this unnecessary suffering and neglect. It is deeply shameful and a stain on our history that our country has allowed this to happen, and is so long now happening after COVID restrictions have been lifted. Some care homes say these restrictions are due to staff leaving the sector when mandatory vaccinations were called into use. And can I ask, therefore, what the Minister and what the government is doing to get those staff back into the care homes, back into those jobs? Could have been up to 7% of staff from care homes that were lost. That's 40,000 employees. So what's the government doing to reinstate them and compensate them for losing their job? As Professor Robert Dingwall told our APPG at the inaugural meeting last year, a good society is defined by life, health, liberty and the pursuit of happiness, not by the prevention of one single disease.
Maria Eagle.
Thank you, Mr Deputy Speaker, and can I also congratulate my honourable friend, the member for Liverpool Walton, and the honourable lady, the member for Chatham and Aylsham, for obtaining the debate, and the Backbench Business Committee for granting it. I have constituents, Jenny Morris and Diane Mayhew, many of you know, who are co-founders of Rights for Residents. And because of the shortage of time, I'm not going to explain in detail what happened to Jenny's mother, but it's quite similar to the experience that the Honourable Lady for St Albans has set out in respect of some of her constituents. But I do want to say a little bit about the ongoing trauma that that experience causes those left behind. Because it's not only the distress of going through seeing one's relative go through the final illness, and the consequences of dementia can be quite distressing at the best of times, but it's the ongoing consequences for those left behind of the restrictions that have occurred. And Jenny says to me that she's hardly had a restful night's sleep since the doors closed on her mother's care home, and she feels like her mother was locked away, and that even though her mother is now unfortunately gone because she died, she says she's plagued by distressing images and painful emotions that won't go away and are having an ongoing impact on her life, because the end of life can often overwhelm some of the earlier positive memories if it is distressing and difficult. And there are many thousands of people who have had this experience of watching from a distance their relatives in care homes deteriorate, be unable to visit them, be unable to comfort them, and watch them die, who have ongoing trauma and will have possibly for many years. And the bad memories come back instead of the good ones, and it can be, I think many people affected in this way do go on to feel like they are being selfish for thinking about their own feelings instead of what happened to the loved one who they have lost. But they are not. They are suffering from deep trauma caused in part by what has happened. Now, Jenny Morrison and Diane Mayhew were co-founders of Rights for Residents and have sought to turn their terrible experience into something much more positive, into campaigning for these changes. And I commend them enormously for that. Just because COVID is no longer seen as the threat that it was at that time, Mr Deputy Speaker, that is not to say that these restrictions have gone away. As many members have actually said, they are still being used in care settings. And in that context, I think it is tremendously important that a legal right is now established. The new data that Relatives and Residents Association and Rights for Residents have surveyed some of their families and discovered is that this harm is continuing. 1 in 5 outbreaks saw residents confined to their rooms. 1 in 9 outbreaks saw residents not allowed any visitors at all. And care homes still implementing blanket visiting restrictions when there's no necessity for any such thing, quite often saying that it's because of guidance, whether government guidance or local authorities have suggested to them that they should have these kinds of restrictions. None of this is accurate, none of this is true, but it is still stopping families visiting their relatives in care homes. Well, how much longer is this going to go on? How much longer is the government going to allow this to go on? And I don't think something highlighted by the Human Rights Joint Committee on Human Rights, that changing the guidance 30 times in a short period of time helps any understanding of what the guidance actually says. That is not helpful. Let us have a law. Let us have a law swiftly that says that residents in care homes, that those having care and health support, have a legal right to be accompanied by a relative, at least one, perhaps sometimes more would be appropriate, but at least one. That is unequivocal, it is clear. It can be clearly understood by whoever needs to understand it. That is the answer to this. I hope the Minister will agree and will swiftly enact such a change.
Thank you very much. Liz Saville-Roberts.
Diolch yn fawr iawn, Llyfyrydd. My mother Nancy had a stroke sometime between Christmas Eve and Christmas Day at the close of 2020. There was no warning, no time to prepare for this catastrophic event. Overnight, she lost her autonomy, her independence, and her agency in her own life. She went into the local district hospital and was transferred from there at the beginning of January 2021 to a community hospital specialising in stroke rehabilitation. She remained there until the end of that February. She came back to live with us for a couple of months, with twice daily home carers, while I, her only child, was still able to vote here and speak in debates without having to be physically present in the House of Commons. She had to move into residential care because the period when I could balance caring and parliamentary duties came to an end. Last November then, she had a fall and she knocked her head. The anti-stroke medication resulted in bleeding on her brain. She was discharged from hospital back to the residential home at very short notice. Just before Christmas, she fell again, she broke her hip, she died in hospital 4 weeks later. These are the bald facts of the event. It was my mother's misfortune to be old and to be in need of clinical services during the first COVID winter. It was the misfortune for all of us as a family that my mother fell ill at a time when COVID infection control demanded the absolute isolation of stroke patients. Many of the key workers with whom we interacted over those 13 months were extraordinary. During the last month of my mother's life, dementia specialist nurse Delith Vaughan-Thomas put me in contact with John's campaign. And she explained to me that in the last month of my family's life, that family contact was a right rather than an optional favour. She was the first person in authority to mention this. And of course, she put me therefore in contact with Julia of John's campaign, who is, I'm glad to say, with other campaigners here in the gallery. Now, look up the long list of hospitals and other organisations which have signed up to John's campaign. They recognise that a key family member is more than a visitor. They are a carer as much as anyone on the payroll. But try and get this information volunteered to you. Try to find out what your rights are. They are not given to you on a plate. People like Delith confounded the cliché of monolithic public sector organisations which may well prioritise institutional interest and risk aversion to the detriment of the service of those services with which provision we entrust them. I think that is something, as the private individual, I think many people will have felt that experience. But nonetheless, in spite of Delith's help, I only touched my mother's hand once during the critical 6 weeks after her first stroke. Yes, we could arrange to speak to her through a glass window as she sat in a stairwell in a hospital and we stood outside in the car park peering in. She couldn't hear us. And incidentally, her hearing aid had been kept in a cabinet all the while and the batteries ran out. Yes, we could phone and arrange to speak over an iPad, but she couldn't hear us. She couldn't understand it. There were no hugs. Health authority infection policy vetoed family bonds of love as a health hazard to be minimised. And of course, at the onset of COVID, we had to adapt and learn quickly about how to cope with an unfamiliar, life-threatening and highly infectious virus. We put in place measures such as lockdowns and visiting restrictions at hospitals and care homes because that was the best that we could do. That's all we knew back in 2020. We had to learn as we went along. But have we truly learnt the most important lessons of all? Treating the elderly and people with dementia as units of flesh and bone by meeting the barest minimum of their physical needs is wrong. We are social animals. Take away our social support and we fail to thrive. Denying family contact causes immediate welfare harm to patients and longer-term harm to family members. This is the context, of course, in which we must apply the abstract terminology of legislation. The Equality Act of 2010 recognises the basis principle that the needs of disabled people should be assessed and reasonable adjustments made to meet those needs. People with dementia and cognitive impairments are disabled. Then there is the matter of human rights, which has been touched upon. Article 2 of the European Convention of Human Rights places an obligation on the state to secure the right to life. Article 8 protects the right to private and family life. But how these are balanced in care settings is critical, and how we shift that balance as we move along also is critical. It is also surprising that the Human Rights Act 1998 applies only to publicly funded residents in care homes. And I close now. This evidently unjust inconsistency is why the government must step in. Why should the owners of private care homes, especially in England where local authority care is far less available than Wales, be able to make such immense decisions and possibly prioritise convenience over residents' and families' rights? Indeed, if we start from the point of view of people in need of care, the care setting itself should not depend on whether it is in the public or the private sector. If the individual has a right, that right goes with them throughout their lives, whether they're in hospital, at home, or in residential care. A right is a right. A right is not a right if its only guide dog is guidance. Guard dog is guidance, sorry, I'm a bit emotional.
Fantastic. Thank you very much. Point of order, Geoffrey Clifton-Brown.
On a point of order, Mr Deputy Speaker, I made a speech in the previous debate on the National Food Strategy and Food Security. I inadvertently, for which I apologise this has, forgot to declare my declaration of members' interest as a farmer and a fellow of the Royal Institute of Chartered Surveyors, and I wish to put the record straight.
I thank the Right Honourable Member for his point of order, and that is now on the record, and I thank him for making that point of order at the earliest possible opportunity. Thank you very much. Fleur Anderson.
Thank you, Mr Deputy Speaker. I'm very keen to speak in this debate and to raise the experience of many of my constituents. And I'm grateful to the member for Liverpool Walton for introducing this debate, and for the members for St Albans and Chatham and Aylesford for sponsoring this debate as well. Many constituents I know have experienced dreadful times during COVID with these restrictions. And in saying that, I want to pay tribute to all of the care workers and care staff who worked tirelessly through COVID and now to take care of care home residents. One of whom was my daughter, who works as a care worker, and so I saw the effect that this has had on her throughout that time as well. And also to say condolences to all of those affected, and to pay tribute for the campaigners for Rights for Residents who brought this campaign to the forefront, and to continue to ask for action. And I hope that we'll hear from the Minister some action today to make the legislative changes we need to make a difference now, and to ensure that we learn the lessons of COVID. We learn the lessons of all these painful stories and experiences that we've heard, so that if we're ever in a pandemic again, the same actions would not happen again. It's absolutely understandable that visiting restrictions were put in place to save the lives of vulnerable care home residents during COVID, but they could have been done differently, with much more consideration for the fact that a visitor is not just a nice to have, but an essential part of care, and that leaving care home residents without visitors led to a huge deterioration in their mental and physical health. Many constituents wrote to me about the effects of this isolation and no contact with their relatives during COVID. As one relative of a care home resident said, "As you are aware, my mother-in-law died, and that's attributed to the effects of isolation and forced separation, and it's paramount that we learn lessons from what has happened going forward." And I visited many local care homes myself, with all restrictions in place, obviously, and heard about the lasting effects that the isolation is having on elderly residents and those who are disabled, even now. For example, residents who've become very reclusive. The government must listen to those care home providers also, who are also demanding an end to visiting restrictions and are not happy about the status quo. Jeremy Richardson, the CEO of Four Seasons Healthcare, which is the UK's third largest care home provider, said, "We are depriving people of their right to visitors, which is an outrage. The government restrictions are making it very difficult to give people a quality of life. We run care homes. We do not run prisons. The restrictions must be evidence-based." In December 2021, an Oxford University study conducted by a team of eminent scientists led by epidemiologist Dr. Tom Jefferson found evidence that many vulnerable residents have died of thirst, starvation and broken hearts during the pandemic. They identified that almost 40% of excess fatalities were not caused by the virus, with many people dying of loneliness and neglect. Without the support of visitors, vulnerable residents were left to deteriorate and die. Neglect, thirst and hunger were, and possibly still are, the biggest killers. It is clear that care home staff had huge amount of additional work during COVID, but also that visitors would have enabled that to be alleviated. The Joint Committee on Human Rights published a report on the human rights implications of the government's response to COVID in September 2020, and a report on care home visiting during the pandemic in May 2021. And following on from this, the committee published a report on protecting human rights in care settings. This report recognised the balance needed between the state's requirement to protect the lives of care users with the other rights, including to a private and family life, and that too often the correct balance has not been struck, and too much has been left to individual care settings to determine, with insufficient respect being given to meaningful contact between care users and their family members and loved ones. And this is why we need legislation to ensure that this doesn't happen again. Instead, the report has recommended that care users are given the right to nominate 1 or 2 more people to visit and provide support in all circumstances, subject to full infection prevention measures, and to give the CQC the power to require care settings to inform them of any changes to their visiting status and report live data, so that there's transparency about changes in visiting rights. The government hasn't yet responded to this report, as has been mentioned by other honourable members, and I hope to receive a response today. The CQC guidance, as we have heard many times, is just not enough. So Rights for Residents are calling on the government to take urgent action to pass legislation that would give every care home resident the legal right to nominate at least 1 essential care supporter that can maintain contact in all circumstances, regardless of outbreaks, lockdowns, variants and future pandemics, and ensure that care homes find ways and are supported to return to pre-COVID unrestricted visiting arrangements without the need for appointments, limits on time, frequency or the number of visitors. In this place, Deputy Speaker, we have a duty to give a voice to those who do not have a voice and to fight against injustice. This debate, I feel, has done this today, and I hope it will be heard. I hope it will result in long-lasting changes of legislation which will save lives.
Wind-ups. Mr Bonner.
Thank you very much, Mr Deputy Speaker, and I add my thanks to the Backbench Business Committee for bringing forward this debate today on such an important matter, and also warmly commend the Honourable Member for Liverpool Walton for leading the debate for us in the House today, as well as the Honourable Members for Chatham and Aylesford and St Albans. We've heard a very thorough and very compassionate debate on such an emotional subject for so many of us and for many more of our constituents, and I'd like to thank all members for their contributions to the debate today. I was touched listening to what the Right Honourable Member for Liverpool Walton said when he spoke about his beloved father and the anguish felt by his family due to that separation. Of course, my condolences and those of my party are with him. I was so touched because it brought back my own experience of watching those close to me fret about the loss of contact with their loved one during the pandemic, and more importantly, how that isolation would be impacting on their beloved parent. Over the last 2.5 years, we have all witnessed the devastating impact of people being completely isolated in health and care home environments, families flatly denied vital contact with their cared-for relatives. The damage of this to people's lives and their health and well-being, I feel, has been immeasurable. And the reality is, as we have heard across the House today, residents are still facing the prospect of spending the final days of their lives in care home settings separated from their loved ones. Families are still currently experiencing major and traumatic difficulties when trying to support their relatives in ill health and in care residential settings. Social connections and meaningful activity, we know, are so important for the health and well-being of people living in adult care homes, particularly so for their actual quality of life. We as a society perhaps did not recognise just how much devastation this prolonged separation would actually cause, or perhaps just how long such restrictions would have to be in place for due to the pandemic. But it is something that we as a Parliament must recognise, and we must do all we possibly can to ensure that it does not happen again. We must also understand how difficult and painful working throughout the pandemic has been for our care home staff, and I would like to place on record, I'm sure the House will join me in expressing appreciation and gratitude to all care home staff who have worked heroically and tirelessly throughout the course of the COVID-19 pandemic. Wherever possible, they worked swiftly to maximise the opportunities for residents of care homes to spend some time with their loved ones, whether that be through a glass or whatever. We know that they try so hard to do so safely and as carefully as possible. But we know that for large periods of time there was no opportunity for that family contact, no opportunity for that loving connection, and sadly for that final goodbye, causing such deep anguish for so many. Mr Speaker, the Scottish Government has recognised this, and we are now taking the steps required on the path to introducing Anne's Law in Scotland. Anne's Law aims to give nominated relatives or friends access rights to care homes, while of course following the same stringent infectious control procedures as care home staff. This follows on from the Scottish Government's introduction of the National Care Service Bill in June of this year, representing the final steps in the process of implementing Anne's Law. Once passed, we will be in a position in Scotland to ensure people living in adult care homes have a legal right to see and spend time with those people most important to them, even in outbreak scenarios. These are positive and progressive steps being taken by the Scottish Government, and I hope the Minister will join me in welcoming Anne's Law onto the statute books and use it as an example. Use it as an example to ensure that all care home residents have the familiar support and family contact that they truly want and that they rightly deserve. Mr Deputy Speaker, I am also aware of the Rights for Residents campaign group who have been campaigning for similar measures to that contained in Anne's Law to be introduced across the other nations of the United Kingdom. I fully support that campaign and hope the Minister will commit to looking closer at it. I also urge the Government to go further still and take the necessary steps to fully integrate health and social care, as has been successfully done in Scotland. The Scottish Government has invested over £1.6 billion into integrated joint boards and are committed to increasing this spend by a further 25%, equating to £840 million by the end of the next Parliament. In addition to this, we have invested an additional £124 million into care at home service provision and provided £200 million uplift to pay for adult social care employees in commission services to bring that pay up to a minimum of £10.50 per hour. We in the SNP know the value of our care home workers across Scotland. They deserve a fitting wage for their outstanding work and service. And to support all of this, an additional allocation of funding will be made available to the Scottish Care Inspectorate to enable it to support and maintain these visitation rights implemented with Anne's Law. The Scottish Government, Mr Deputy Speaker, are forward-leaning and are taking the necessary steps to fund social care to support the people who live and work in social care settings, and I urge the UK Government to do likewise. And just finally, Mr Deputy Speaker, I just wish to reiterate, for the sake of all vulnerable care residents, wherever they may be across these four nations, I ask the UK Government and I urge the Minister to take the steps required to guarantee their legal right to maintain contact in care settings. Thank you.
Ms Kendall.
Thank you, Mr Deputy Speaker. I really want to thank the members for Liverpool Walton, Chatham and Aylesford and St Albans for securing this hugely important debate. And I hope the member for Liverpool Walton will forgive me for saying that I thought he spoke incredibly bravely and powerfully about his father, who I'm sure would be very proud of him today. Now, the terrible consequences of banning families from seeing their loved ones in care homes is an issue very, very close to my heart. It's something that Labour has been campaigning on since June 2020 during the very first COVID lockdown. Indeed, we first called on the government to bring forward a legal right for care home residents to see a family member or friend in February 2021, and we continue to do so today. Because, as we've heard already in this debate, this issue hasn't gone away. And because we need to ensure that with winter almost here, and God forbid in the event of any future pandemics, the rights of residents and relatives are clearly guaranteed by law. And we make this case because it's good for residents, it's good for family members, and it's good for care staff. I'll say more about this later, but I want to start by thanking the organisations who've campaigned so hard on this issue, including Healthwatch, Mind, MenCap, the Alzheimer's Society, Parkinson's UK, Dementia UK, and Disability Rights UK. And I especially want to thank the Relatives and Residents Association, John's Campaign, and Rights for Residents, who have been at the forefront of this campaign. In particular, I want to pay tribute to Jenny Morrison and Diane Mayhew from Rights for Residents, two phenomenal women who have blazed a trail on this issue. After their own terrible personal experiences, they set up Rights for Residents to give a voice to all the other care home residents and families who've been banned from seeing their loved ones. The reaction to their campaign has been astonishing. Something I saw for myself when I joined them in Downing Street, or just locked outside actually, in September 2021, when they presented a petition calling for the change in the law, signed by more than 250,000 people. And almost all of the campaigners I met had never been involved in protests or petitions before. They weren't there because of any political agenda, but because of their own personal experience and that they wanted to see a change. And the reason why so many people joined Jenny and Diane is that this issue really matters. It matters to thousands of families who've faced unbelievable anguish, guilt and distress because they were banned from seeing the people they love most. Their mothers, fathers, husbands, wives, brothers, sisters, sons and daughters at a terribly frightening time. It matters because of the physical and mental impact isolation has on older people and, as the member for Chatham and Aylesford said, really crucially, people with physical and learning disabilities. We've heard and seen so much evidence about increased depression, anxiety, people losing weight because they're not eating. Because the truth is, as the member for St Albans said, families aren't just visitors, they are an essential part of the care given to residents and should be treated as such. And banning families from seeing their loved ones also matters to care home staff. There is lots of international evidence that staff in many countries have faced increased workloads because some of the emotional and other support, which was normally provided by families, like help with eating and taking people on walks, just completely disappeared when they were banned. Now, there's much I could say about all the powerful things people have said from their own constituencies, and I was contacted by many deeply distressed constituents too. But because time is short, I want to emphasise something that hasn't really been mentioned yet today, which is that families have always understood the need to protect their loved ones from COVID. They never wanted to expose them to unnecessary risks. All they wanted was to be treated the same as care home staff. You know, they couldn't understand why, once the PPE and testing and vaccines were finally available, why were they banned and treated differently from everybody else? Now, throughout the pandemic, the government has resisted calls for residents to have a legal right to see their family member. They've consistently said that the guidance they issued was enough. But the guidance, which has changed over 30 times during the course of the pandemic, is not enough. We have seen that time and time again. And I want to say 2 points here. Firstly, anything that is issued 30 times is going to be totally unclear and people will lose track and it won't be properly followed. And secondly, the clue to the problem with guidance is in the name. It's guidance which can be ignored. Neither is oversight from the CQC enough. You know, the Joint Committee on Human Rights said back in May 2021 that there was an, and I quote, astonishing lack of awareness in the CQC as to whether care homes were allowing visits or not. And the chair of the committee, the Right Honourable Member for Camberwell and Peckham, said at the time the CQC's assurance that visits were being allowed was wholly unconvincing. And we've heard evidence today that that remains the case. And we know that the guidance and regulations are not working or being enforced today. The Relatives and Residents Association and Rights for Residents recently surveyed over 650 families. They found visiting restrictions during the majority of COVID outbreaks between April and September this year were more restrictive than advised by current government guidance. 1 in 5 outbreaks saw residents confined to their rooms, and 1 in 9 saw residents not allowed any visitors at all. And shockingly, 45% of families who responded said there were visiting restrictions in place despite there being no COVID outbreaks at all. That's why they've repeated their call for a new legal right to guarantee people's access to in-person support from at least one care supporter, a person important to them, such as a relative or a friend. Members on this side of the House agree. So too does the Cross-Party Joint Committee on Human Rights. They say the default position must be that those in care homes are able to receive visits from a significant person and that blanket bans are in breach of the legal right to family life. I actually think there's quite a bit we could learn from other countries here. I understand the Dutch Parliament has recently passed or accepted the Corona Act, which guarantees that each resident has the right to welcome at least one visitor in the case of COVID-19 outbreaks. So I ask the Minister to look at this again, to heed what families want, what organisations representing residents and families demand, and what is done in other countries, and put this legal right in place.
The Minister, and please just to remind the Minister to leave a couple of minutes at least at the end for Mr Carden to wind up. Thank you very much.
Thank you, Mr Deputy Speaker. I will say, for me, it's truly a rare minister who would welcome a debate on day one following their appointment. But I will say that truly I do welcome this particular debate because it is so important. And visiting in care settings is something I have spoken to many people about, and it's something that I had hoped that by now would no longer be a problem now we have put lockdowns behind us. But it is still a problem. Can I thank and commend the Honourable Member for Liverpool Walton, Member for St Albans, and my Honourable friend for Chatham and Aylesford for leading this debate and for their powerful speeches, and for all others who have also contributed very powerfully today. I'd also like to thank those who have been campaigning so hard for visiting rights, like the Rights for Residents campaign, John's campaign, and the Relatives and Residents Association. I know indeed that some of you are here with us in Parliament today, and I'm sure that many others are watching from home. I do also recognise the efforts that so many care homes have made to get back to normal, or as close to normal as they can, on visiting after the enormous challenges of the pandemic, because visiting matters. Visiting matters for the resident in a care home, and we must never forget it is indeed their home. Visiting matters for family and friends who want to spend time with their loved ones. It can be the moment that a resident looks forward to all week, a time that keeps their connection to life beyond the doors of the care home, and, not to be underestimated, the chance to hold the hand or have a hug with someone who loves them. And I say this knowing that sadly many residents in care homes are living with dementia and may be confused or unable to remember things for long.
Will my honourable friend give way?
But in one moment, visits matter for them and their families, not least because dementia can progress so cruelly. And this is something particularly that my honourable friend for St Albans referred to. I will indeed give way.
I'm very grateful to my honourable friend for giving way, and she's absolutely right to talk about the impact particularly of dementia. During lockdown, the number of people who wrote to me, including a close family member of mine, whose dementia so significantly worsened because they weren't able to see family members just to keep those memories going. It was absolutely terrible, and I think we should do everything we can to make sure that cannot happen ever again.
Well, I thank my right honourable friend for making that point, as we have heard from others in the chamber today. Mr Deputy Speaker, visiting is not just a nice to have, as we've heard just then, and from all the stories that we've heard today can leave us in no doubt. The Honourable Member for Liverpool Walton spoke very movingly. He spoke about some experiences from others, but also his own personal experience with his father, which he very courageously shared with us. And the Honourable Member, whose constituency I can't pronounce, but Hansard will resolve it, spoke as well very powerfully about her mother. I'm sorry for both of you for your losses there. And my honourable friend, the member for Chatham and Aylesford, actually very importantly reminded us that this isn't just about older people, that also visiting is so important both actually into a residential setting and out of it for younger people, for instance, younger people with learning disabilities. I'm short of time, so I will press on. But on top of the stories, Mr Deputy Speaker, there are the facts. We know there's a body of evidence which supports the argument that not having visitors can be detrimental for the health of people living in residential care. And in fact, this is something the my right honourable friend for Tatton referred to. For instance, there's a connection between social isolation, loneliness and mental health. I'll say, in fact, back in October 2020, when I was previously Care Minister, I commissioned research on the benefits of visiting, as well as an assessment of the risks at the time and the options for opening up visiting. I'll also say that I do know personally what it feels like not to be allowed to visit a relative. In the summer, my mother was admitted unexpectedly to hospital, and I was not allowed to visit her, even though I did not know whether I would ever see her alive again. And the same was the case for my father, her husband for 50 years, who was also barred entry to the ward where she was. And that was clearly even though we were not in the heart of the pandemic by any stretch of the imagination. Mr Speaker, I'm going to look at this in three parts at pace. Firstly, what has happened to get us to this situation. Secondly, what is really going on. And thirdly, what can be done. During the pandemic, we sadly saw how hugely vulnerable to COVID people who lived in care homes were, and the government's priority was to keep people safe, which meant doing everything possible to prevent COVID getting into a care home. It meant reducing the number of people going in and out who might take in COVID. It meant requiring the use of PPE. It meant regular testing for care home residents and staff. And when we got the COVID vaccine, it meant prioritising vaccinations for care home residents and staff. However, even back in 2020, we knew that residents in care homes and their families were suffering from the visiting restrictions. Though I should mention that not all residents and their families had the same views. Actually, while some wanted more visiting, others did not, because they were more worried about the risks. But balancing those two things, government sought to enable visiting in ways that would be safe. And we made it clear that end-of-life visiting should always be possible. Then in March 2021, we introduced the concept of the essential care visitor, who should be able to visit a resident who needed personal care in any circumstances, including during an outbreak, following the same COVID testing regime as staff. And then in June 2021, we expanded that to apply for all residents. At all times, we worked with social care providers with care homes because they were the ones who had to put the guidance into practice. They were the ones at the front line balancing prevention of COVID with the practicalities of supporting visiting. And actually, I don't underestimate the demands that put on care homes who are also carrying out testing and providing PPE and everything else. That brings me to then the situation today. Since April 2022, the government guidance has been that there should not be any restrictions to visiting in residential settings unless there is a COVID outbreak. And even if there is an outbreak, every resident should be able to have a visitor. Local public health teams may advise other restrictions on visiting if there's a particular local risk, but that should be proportionate and should only stop visiting in extreme circumstances. Now, I've heard today from honourable members some saying that the problem is that the guidance is not clear. and others saying that the problem is that the guidance is not being followed, and indeed, as the Honourable member said from his seat, the problem that it is guidance. I will say on the first issue, on the content of the guidance, certainly what we've heard from many accounts is that the guidance is not being followed, and so that is definitely something which I will be taking away today to do further work on. I will say, and knowing the concerns that there were back during the height of the pandemic about visiting, the Department of Health and Social Care started tracking visiting restrictions, actually an initiative, something I started as Care Minister, to try and get some data about what was going on, because that's one of the challenges with social care, is actually knowing what's going on at the front line across such a diverse and relatively fragmented system. Our data does tell us, or told us in September, that 98.4% of care homes were allowing visiting. But I do recognise that that data isn't the whole answer. Coming to CQC, which has come up several times during this afternoon's debate, I did speak with Kate Roney, the Chief Inspector of Adult Social Care at CQC, many times during the pandemic about visiting, and she too saw the importance of visiting. CQC looks at visiting when they inspect care homes, and a lack of visiting rights or access is a red flag for them. Families should be reporting visiting concerns to CQC, who then investigate these complaints. I have absolutely heard, though, the points made by the Honourable Member for St Albans, who talked about some families feeling they got a mixed response, or also families who are very fearful about reporting to CQC and the consequences that there might be. So again, that is something that I will take away from today's debate. Under the existing regulations, CQC can take action if they believe that safe and proportionate visiting is not being facilitated. But I also heard the Honourable Member for Liverpool's point about CQC powers to get live data being limited, and then not having powers to require a care home to report changes to visiting restrictions. So things I will indeed take away and look into with CQC. And so clearly, while we have the guidance and we have the CQC ability to take action from care homes, clearly there is still a problem. I'd say I've also seen the data from the Rights for Residents survey, and their data that said for 45% of responses there were still restrictions in place to visiting since April, and in 11% of outbreaks no visitors being allowed at all. So it's something, again, I'm very concerned to see. Yeah, I am indeed happy to give way.
Extremely grateful to her. Will she therefore, we're all on tenterhooks, undertake to implement a legal right, as Rights for Residents call for, to enable visitors to have a legal right to visit?
Minister.
So if she will bear with me, I'm literally just getting to the point about the third of the three-part thing of considerations of this, which is what can be done. And to this point, so back in April 2021, I was questioned by Parliament's Joint Committee on Human Rights on this very topic. And I said then to that committee, I said, I want to get to a position where visiting is as normal as possible. I said then, this is something to come back to in the future, particularly if family members and residents feel that the situation is not working as they would want it to, and clearly family and residents do indeed feel the situation is not working. I do want to reiterate, I understand that things are not easy for care homes. I understand the staffing pressures and the recent increase in COVID and also flu, which many residents are vulnerable to. And we also know that the majority of care homes are allowing normal visiting. And also, as other members have said today, many care homes totally recognise the importance of visitors. I'm actually very short of time, so I've got 2 minutes, I won't if she'll allow me. Care homes recognise the importance of visitors, but we cannot continue to have this situation with families and friends struggling to see loved ones in care homes. That's why I have already commissioned work today, my first commission since my appointment, on the steps that I can take to sort this out. To the honourable member's question, no, I can't announce here and now the dispatch box legislation, but what I've said to her, I've commissioned work on what we can do, what I can do to sort this out. I will assure all honourable members in the chamber and all those listening that I do not consider the status quo acceptable, and I am on the case. Thank you.
I'm grateful, Mr. Deputy Speaker, to you for chairing this debate today. And I was also watching the faces of the campaigners in the gallery who I'm sure wish they had a voice down in this chamber today. But having said that, I take the Minister's word. It may have been a bit much to ask that on her first day she committed to legislation, but she knows that the campaigners will not be going away and that I and other honourable colleagues will be continuing to make the case for this. We have to put right what has gone wrong during COVID. We must say that the care of loved ones is an essential part of care, and there is an easy solution to this, as has been put forward by many colleagues today, that essential caregivers, loved ones, can be treated in the same way as staff. Finally, Mr. Deputy Speaker, the only way to resolve this is to put a right in law by this place in legislation. And I think we can all agree on the principle that whether it's the state or a privately run care home or a hospital, it does not have the right to separate family and loved ones. And the right to visit a loved one in a care setting is one that we should all enjoy across this country. Thank you.
It's been a privilege to chair this very emotional and effective debate. So the question is, as on the order papers, may I please say aye? Of the contrary, no? I think the ayes have it. The ayes have it. Point of order, Sarah Jones.
Thank you, Mr. Deputy Speaker. On a point of order, Mr. Deputy Speaker, the Shadow Home Office team have been seeking clarity on security breaches involving the Home Secretary and serious discrepancies in the information provided to Parliament. Yesterday, the Prime Minister stated in this House that the Home Secretary made an error of judgment, but she recognised that, she raised the matter and she accepted her mistake. This was contradicted last night by the former Conservative Party chairman, the member for Rossendale and Darwin, who stated that the Home Secretary was presented evidence of her breach rather than proactively reporting it. Similarly, the Home Secretary has claimed the breach related to an immigration written ministerial statement. But the former Conservative Party chairman claimed it related to cyber security, and other media reports state it was a set of Cabinet papers. The Cabinet Office has now reportedly confirmed that they will not investigate the circumstances of the Home Secretary's original departure nor her reappointment. These are questions of national security and are incredibly serious, and public and the Parliament deserve answers. So, Mr. Deputy Speaker, this is the latest in a series of attempts to get answers, and I ask your advice on how we can compel the Home Secretary to come to this House and answer questions about the accuracy of her resignation letter and the media briefings that have followed.
Thank the Honourable Lady for her point of order and her advance notice of it. Whilst the Chair has not the power to compel ministers to